Welcome to Podcasts on Demand, a continuing medical education activity. This activity includes the most recent and current clinical data presented by leading experts. If you are seeking continuing education credit, please review the disclosures and the requirements for successful completion of the activity prior to listening to the podcast. A link is found in the podcast description that can direct you to this information.
Welcome to Optimizing Outcomes in Psoriasis, exploring the impact of rapid diagnosis and emerging therapeutic agents. I'm Dr. Bruce Strober. I'm a clinical professor of dermatology at Yale University School of Medicine and the co-scientific director of the comorbidities Psoriasis Registry, the vice president and president-elect of the International Psoriasis Council, and the editor-in-chief of the Journal of Psoriasis and Psoriatic Arthritis. Today, I'll be focusing on a pressing issue in dermatology, psoriasis. Specifically, I'll explore how rapid diagnosis and emerging therapeutic agents can optimize treatment outcomes for patients with this chronic condition. Psoriasis is a common chronic immune-mediated inflammatory skin disease affecting approximately 125 million people worldwide. It is characterized by red, scaly plaques and results from a complex interplay of genetic, immunological, and environmental factors. Despite significant strides in treatment, ranging from topical therapies to biologics, healthcare professionals still face challenges such as adverse effects, treatment resistance, and high cost. In today's podcast, I'll review these challenges, examine emerging therapies, and discuss how patient-centered care can play a pivotal role in managing psoriasis more effectively. By integrating these insights into clinical practice, we can significantly improve patient outcomes and quality of life. Let's start with the current challenges in treating psoriasis. It's a condition that affects about 2 to 3% of the global population, often causing not just physical discomfort, but also psychological distress. Stigmatization and reduced quality of life are common issues that need addressing. One major hurdle is treatment adherence. The chronic nature of psoriasis, coupled with the inconvenience and side effects of treatments, often leads to poor adherence. This can result in suboptimal disease control and an increased burden on patients. Traditional therapies such as methotrexate and cyclosporin are effective but come with significant potential side effects like liver toxicity in the case of methotrexate, renal impairment and hypertension in the case of cyclosporin. Additionally, variability in patient response complicates treatment plans. Factors such as genetic differences and comorbid conditions can make it challenging to find a one-size-fits-all solution. The challenge with oral versus injectable medications in psoriasis lies in balancing the ease of oral administration with potentially lower efficacy in severe cases against the higher effectiveness and targeted action of injectables, which can be less convenient and costlier. Topical treatments, while often effective for mild to moderate cases, lower BSA, are sometimes overused, leading to inadequate control, progression of disease, and patient frustration. But it's not all bleak. There are opportunities emerging in the form of advancements in understanding the disease mechanism and the development of new treatment modalities. Personalized medicine approaches are becoming more feasible with advancements in genetic and biomarker research. We still await the implementation of tests that will definitely guide personalized treatment choices. Early intervention with systemic treatments and proactive strategies to prevent comorbidities such as psoriatic arthritis also hold promise. Furthermore, concomitant approaches to addressing aspects of metabolic syndrome, such as obesity and psoriasis, offer the opportunity to improve overall health outcomes and enhance disease management by targeting both skin inflammation and associated systemic risk factors. Over time, some dermatologists will increasingly recommend weight loss and obesity reduction strategies for improved control of skin diseases. Moving on to treatment approaches, let's break down the options available. Conventional therapies include topical treatments, phototherapy, and systemic agents. Topical treatments include corticosteroids, vitamin D analogs, and coal tar preparations. They're typically used for lower severity psoriasis, lower BSA, but require long-term application, which can lead to side effects like skin thinning and striae in the case of corticosteroids. Newer topical therapies include type 4 phosphodiesterase or PDE4 inhibition and aryl hydrocarbon receptor agonism. These drugs display none of the potential side effects of topical corticosteroids. Topical therapy still can create frustration for patients, particularly when used for more severe psoriasis involving a large body surface area, for example, more than 7%. Phototherapy is suitable for patients who wish to avoid systemic agents or when cost is a concern. Phototherapy includes narrowband ultraviolet B and less commonly psoralen plus ultraviolet A or PUVA. These therapies can be very effective for moderate to severe cases, although they require frequent visits and might come with long-term risk of skin cancer, particularly in the case of PUVA. Sometimes copays are high for each phototherapy visit, precluding the financial feasibility of this treatment approach for some patients. Systemic agents such as methotrexate, cyclosporin, and acitretin are used for more severe cases, but necessitate close monitoring due to the potential and wide-ranging significant side effects, including liver toxicity in the case of methotrexate, renal impairment in the case of cyclosporin, increased risk for infection with both methotrexate and cyclosporin, and potential teratogenicity in the case of acitretin, necessitating close monitoring and careful management during treatment. In fact, I rarely use these medications in my current practice, given the advent of more modern choices. Treatments for systemic appropriate psoriasis include small molecule medications, biologics, and phototherapy. Recent advancements in biologics and small molecule therapies are revolutionizing psoriasis treatment. Biologics include tumor necrosis factor inhibitors, interleukin 17, 23, and 12/23 antagonists. In the case of generalized pustular psoriasis, an interleukin 36 receptor antagonist has recently been approved. Newer biologic agents offer more targeted treatments with improved safety profiles. By inhibiting specific components of the immune system, these biologics reduce inflammation and skin cell proliferation. Biologics generally offer higher efficacy and longer periods of disease control, with potentially fewer side effects compared to traditional systemic agents, though they are often more expensive and usually involve injections. Oral small molecule medications include TYK2 inhibitors or phosphodiesterase type 4 or PDE4 inhibitors. Small molecule therapies modulate intracellular signaling pathways to reduce inflammation. They offer a convenient oral administration and may be effective across a variety of inflammatory conditions. Oral small molecule therapies offer ease of use, but usually display lower efficacy than the newer biologic therapies. Clinical trials have shown promising results with newer, or as I call them, modern biologic agents, demonstrating high rates of skin clearance, excellent tolerability, very little monitoring requirements, and improved quality of life for psoriasis patients. Additionally, small molecule therapies have shown benefit in providing effective and convenient treatment options with favorable safety and tolerability profiles. Clinical trials and studies on the safety and effectiveness of biologics and small molecule inhibitors are crucial for personalizing care and treatment for psoriasis patients. However, some contraindications to these medications remain. For example, interleukin 17 inhibitors can very rarely trigger new cases or worsen existing inflammatory bowel disease. Additionally, using tumor necrosis factor inhibitors requires extra caution in psoriasis patients who also have congestive heart failure, multiple sclerosis, or cancer. On the other hand, type 4 phosphodiesterase or PDE4 inhibition might cause weight loss, which could have some positive metabolic effects for some patients. By understanding how these treatments interact with various conditions, we can better guide patients with specific comorbidities. These trials have demonstrated the efficacy and safety of these agents, contributing to their approval and use in clinical practice for treating psoriasis. With the numerous treatment options now available for psoriasis, clinicians face the challenge of deciding which systemic or biologic drug to start with, as it's hard to predict how a patient will respond to a specific therapy. Identifying the right patients for targeted therapies is crucial. Factors to consider include patient preferences, oral versus injectable, comorbidities, disease severity, location on the body, impact on quality of life, and in previous treatment responses to these therapies. Patients with systemic appropriate psoriasis, including those affecting the high impact areas, such as the scalp, palmoplantar regions, genital areas, nails, and the intertriginous zones, often require more aggressive treatment approaches due to the failure of topical therapy and the significant impact on patients' quality of life and daily functioning. The presence of comorbid conditions like psoriatic arthritis or obesity can also influence treatment choices. For example, one would like to use a drug effective for both the skin and the joints in a person who has significant psoriatic arthritis accompanying their psoriasis. Shared decision-making is key to effective psoriasis management. Involving patients in their treatment plans helps align therapies with their goals, values, and preferences, which improves patient satisfaction and adherence. While tools like decision aids, brochures, and interactive apps can facilitate the process, I find that clear communication about treatment options and potential outcomes and the time course until improvement is realized is more effective in engaging patients and fostering their commitment to treatment plans. Managing psoriasis involves more than just picking and prescribing the right medication. Effective chronic disease management requires a holistic and proactive approach, including educating patients, screening for other health conditions, and adjusting treatment based on how the disease progresses. Patient education plays a vital role in managing psoriasis. Self-management techniques, including regular skincare and recognizing triggers, are crucial for long-term success. Support systems, including healthcare teams and support groups, provide emotional support and practical advice. Technologies like apps and telemedicine offer ongoing support, enhancing patients' ability to manage their condition effectively. This brings us to the end of this podcast. To recap, the rapid diagnosis of psoriasis, combined with the advent of emerging therapeutic agents, marks a transformative period in the management of this chronic inflammatory disorder. Early identification of the disease enables timely intervention, prevention of progression to more severe forms, and reducing the risks of comorbidities such as psoriatic arthritis. The development of novel biological agents and small molecule therapies targeting specific immune pathways offers highly effective treatment options with improved safety profiles. Equally important is the integration of patient preferences and values through shared decision-making, which enhances treatment adherence, satisfaction, and overall outcomes. As we look to the future, ongoing research and innovation are essential for developing more effective therapies. I encourage you to stay informed about the latest advancements and actively involve patients in their care plans. By embracing new therapies and fostering patient engagement, we can significantly enhance the quality of life for those living with psoriasis. Thank you for joining us on this podcast. To receive continuing medical education credit, please return to the activity webpage and click on the Claim Credit button associated with today's podcast. You can also find more discussions on cutting-edge medical practices and treatment innovations. Until next time, I'm Dr. Bruce Strober, wishing you a great day and successful patient outcomes. Goodbye, and thank you for listening.
We hope you found this podcast useful and educational. To receive continuing education credit and to download your printable certificate, please go to the activity page at practice.cme.com to complete the post-test and evaluation to receive continuing education credit.